Here in the Triad, more than 2,000 contractors are working round the clock to make sure that students in Alamance Burlington schools can return to class by next Monday after mold was found in dozens of buildings.
And now some parents are wondering just how long it's been an issue and the impacts it could have on their children.
WXI 12 Joshua Davis spoke to experts about just that and joins us in studio with more. Joshua?
Christine, Devontae, one of the experts I spoke to about mold remediation says mold is everywhere and there's a balance that needs to be maintained when managing indoor environments. It's when things get out of balance that issues arise that can affect a person's health. Brian Carlson is the owner and operator of ServPro, where they routinely handle mold remediation. He says the first thing to understand is the easiest way for mold to invade a space is through water damage.
When our building materials get wet and they're not dried properly or mitigated in industry term, then mold can develop. And if left unattained, the mold will just get worse and worse in most cases.
A major concern with the ongoing Alamance Burlington school system mold issue is the presence of mold harmful to humans in 16 schools and how long mold was in those schools for it to become toxic. Carlson says when it comes to mold development, there isn't an exact timeline.
Because we're talking about how long it's harmful to a person, and all of our immunologies are a little bit different. There are mold levels that could irritate you before they irritate me, or vice versa.
The way mold exposure can affect humans who are in the school building, either as students studying or as adults working there, is twofold.
Dr. Murali Ramaswamy is the Center Director for Pulmonary Fibrosis at LeBauer Healthcare with Cone Health in Greensboro. He says in the short term, symptoms of mold exposure are a lot like allergies, but in the long term,
over a long period of time, which could be months or years, then people can develop a condition called hypersensitivity pneumonitis, HP. And then over time, what can happen is that with patients' lungs can get scarred up, and then they can develop a condition called pulmonary fibrosis, otherwise called chronic HP. And these two are not good situations to be in.
Dr. Ramaswamy says then it's for the best that kids aren't currently in class and that cleaning the environment is the best way to avoid future problems.
Not going to the campus is a good thing because the exposure is not there. But I believe they can return once there's remediation in the place and the buildings are clean.
If I were the contractor in charge of this job, though, it would be, my end goal would be to make sure that I have very, very clean air test results in all of the classrooms. We want to prove to our client that what we did was effective. And so we want to do air testing because we want to leave the house in a good condition for our client.
I also reached out to ABSS about the continued plans of remediation. The district says they have a third party handling post-remediation testing and air quality verification and will post certification of that on their website. They also said in light of these events, they're developing protocols of having their buildings inspected by outside contractors. The district says, quote, "We remain in crisis mode and our immediate attention is being placed on getting students back in our buildings on Monday, September 11th. We will look at long-term solutions with our county commissioners once we have students back face-to-face with our teachers." In studio, I'm Joshua Davis for WXII 12 News.